2 days after failing to get her CPR certificate in a health class, a 16-year-old girl breathed life into a 74-year-old man who suffered a massive heart attack at a bowling alley in Rockaway, New Jersey. Today, Christina Fairclough of Denville is to be named an honorary citizen of Rockaway, New Jersey for her actions. I just thought nobody else was doing anything, she said. It was like I was the only one that noticed. I know CPR, I got this, she remembers telling herself as she readied herself to act. Hi, I'm Viviana, and welcome to the Mayor's Youth Council talk show. On today's show, we're going to be talking about CPR with Dr. Ken Massey from Farmington Hills City Council. What is CPR?
Oh, thank you for inviting me, first of all. What is CPR? CPR is actually an acronym for cardiopulmonary resuscitation, and it is the series of activities that one does in an emergency situation to try and restore the heartbeat and breathing of somebody who's had a cardiac event.
Okay, so what got you involved in advocating for the CPR training in our community?
Well, a very long time ago, my first occupation, I was a paramedic while I was doing my training. So CPR, cardiopulmonary resuscitation, first aid, so forth, were all things that I was doing as part of my job. But when one looks at the statistics of how out-of-hospital survival rates when somebody has a cardiac event, it's very clear that in those communities that have CPR as a routine part of the high school education, those communities have a much higher survival rate. Just to put numbers to that, the average out-of-hospital survival rate for a heart attack is about 5% when somebody's heart stops. In communities where they've had CPR training mandated as part of a high school curriculum, where almost all of your students have to take that, obviously to graduate, their out-of-hospital survival rates are above 20%. They approach 21.5%. That right there is a profound statistic. That was what caused me to really start to advocate for the training of our youth in our high schools so that it makes our community safer. There's an additional spin-off too, and that is that in communities where CPR training has been part of the high school curriculum, you also have a lower incidence of out-of-hospital cardiac arrests. And there's some reasons that have been postulated for that. Most prevalent is that as part of the training, people are taught what signs and symptoms are for heart disease, so they seek medical attention sooner. So if you have a situation where you have fewer out-of-hospital events and then more people survive those, it seems to me to be very simple that that's something that we should be doing in our community.
Oh yeah, okay. So what kind of situations would you use CPR in?
The types of situations, they're varied. The long and short of it is when somebody is not getting adequate circulation, their heart has stopped and they are not being able to get blood to their brain, they have 10 minutes of potential survival. So the reasons that somebody's heart can stop, one is that they've had a massive heart attack, another is drowning, another is an electrical shock, another is in a situation where they have an allergic reaction that's very profound and it causes them to drop their blood pressure to a point they don't have a pulse. So in those types of situations, all emergent situations, the key to that person's survival is being able to circulate blood to their brain. And those would require the activities that we know as CPR, cardiopulmonary resuscitation.
Oh, okay. So why is it important to start CPR? Shouldn't you just wait for the fire or police department?
Well, as one of the first steps, you want to call for professional help. So you will be summoning fire and police, but no matter how close they are, there is a response time. That response time, even if it's 2 or 3 minutes, those 2 or 3 minutes are critical in the survival of that person. You have 10 minutes of survival. For every single minute, you lose 10% of your viability. And after 10 minutes, there have been numerous reports where somebody is resuscitated, they get a blood pressure, they get a pulse, but they've suffered such severe brain damage that that person has no quality of life, and they often just succumb to something else. So those first 10 minutes are absolutely critical. And if you can start CPR in that first minute or two after you've called for the fire department or the police department, you can really enhance that person's survivability. You can make a difference and save that person's life.
Yeah, so how prevalent are CPR classes in high school throughout the state and country?
It's a great question. CPR classes have not been mandated. They're in some school districts, they're part of a health curriculum, or they're an optional class. In the country, there are at least 3 areas. The first one is King County, which is in Oregon. They have mandated CPR training in high schools for the last 35 years. Jacksonville, Florida is another such area. There are very few of those, and they're kind of spread out. Now people are starting to realize the significance of CPR training and how easy it is to do. So there are 6 states that are starting to look at it as a requirement for graduation. In Michigan, that number is much lower, and I would love to see our community being the first one having it as a high school graduation requirement.
Oh, so in Farmington Public Schools, how many of these classes have been held and how many students have participated?
Well, what we've been doing is that both city councils of Farmington and Farmington Hills have passed resolutions. The school board has started to work with us now, and they're looking at how they can insert CPR training into the curriculum. And there's some significant amount of scheduling work that has to be done for them to do that. As that's being done, we've offered CPR classes to our youth during half days, and we have 5 scheduled in this year. 3 of them have already occurred. The first one was held at Harrison High School, the second at North Farmington, and the third at Farmington High School. There are 2 others scheduled, again at Harrison and again at Farmington. So far, the number reported by the fire department who's participated in the training is that 94 of our young people have gone through that training in those 3 classes.
Oh yeah, so what are AEDs and what role do they play in CPR?
An AED, let me give you a little bit of background. So cardiopulmonary resuscitation is the hands-on chest compressions that are the emergency first aid. The problem in somebody who, in about 90% of the time, when someone has a cardiac arrest and they're not circulating blood, the electrical activity that stimulates the heart to contract is disturbed. The definitive therapy is to defibrillate that person. The defibrillation is simply applying electrical impulse across the heart, and it resets, if you will, it will reset that sequence of electrical activity. An AED, or automatic external defibrillator, which we have one sitting here on the table. This is a standard, very, very commonly seen AED. An AED is simply a device that is applied. There are 2 pads. You apply the pads to the person's chest. You push the on button, and the AED works as its name implies, automatically to detect that patient's heart rhythm, and if it's appropriate, it will create an electrical shock to try and restart that person's heart. If it doesn't work the first time, the device will actually tell you to resume CPR, and you resume those chest compressions, and it will stop you at a point. It'll say stop, and then check the rhythm again, and it will then deliver another electrical impulse to try and get that person's heart started. The beauty of the AED is it interfaces with the fire department's equipment, the defibrillators they carry in the ambulances, so that when the fire department arrives, the patient's already hooked up. They can then use that equipment in their treatment of the patient as well. So it interfaces very nicely in the chain of survival that we want to see patients undergo if they have an event.
Yeah, so how is CPR training taught?
The only way to really do CPR training, I'll use an analogy, it's much like learning to play the piano or any other motor skill. It's taught in a classroom setting where you have a certain amount of instruction, but really you have to get down, you have to practice. And there are mannequins that are especially designed to give you the feel, the look of doing the compressions. And then the people, as you go through the class, you get that information, and then you actually do the hands-on compressions, and you practice the actual rhythm that you would use to perform CPR. So it's really a manual learning type of scenario.
Yeah, so what does one learn in a half-day class of CPR?
The beauty of CPR now is that it can be taught in about 3 hours to a level that you can be certified. In these half-day classes, what we are teaching, or what's being taught, I should say, is the actual chest compressions, the CPR itself, rescue breathing, the ability to use how to set up and utilize an automatic external defibrillator or an AED. You learn first aid for choking, and I know that the fire department instructors also try and provide some additional first aid, how to stop bleeding, and some other key pieces of information for the students to make it a more full, rounded experience.
Oh yeah. So if someone takes this class, does that make them certified, and how often would you have to be recertified?
The intent is at the end of the course that you are certified, which just means that you have a card from an authorizing agency such as the Red Cross or the American Heart Association that says that you've taken a class and you've passed all of the requirements. That's just important. If you perform CPR, one, you have a certificate that says that you've been trained, gives you the knowledge that you know it, and if anybody was to ever ask you, have you ever learned this before? Yep, you can show them that you have a card. The suggestion through the American Heart Association is that you recertify about every 2 years.
Yeah. So what if someone wants to take this class, but they can't take it the day it's offered?
Well, there are other opportunities. You can take CPR. We're trying to get it offered through the schools, and we have on these 5 half days. If somebody wants to avail themselves, if you look in the special services bulletin in the City of Farmington Hills from Parks and Recreation Special Services, we offer CPR training at other times during the year. It's often provided through the fire department. In our community, you can take CPR classes through Community EMS's training, which I think is called LTSI, Life Training Institute. You have that as an option. And then the American Red Cross has a presence here. American Red Cross and American Heart Association hold classes in our area as well. So there are any number of different places that you could go to take the class.
Oh, okay. And how does this training help our community?
The thing that I like to keep reminding people is that by investing a couple of hours of your time, you are making our community safer. I've taught a number of CPR classes myself, and I often start with, why did you want to take this class? And you ask people that. And sometimes the answer is because a family member of mine had a heart attack and I felt helpless. And now I want to make sure I don't have that feeling again. Well, my father used to use a phrase that's like closing the barn door after the horses have left. You may never get the opportunity. Hopefully you never have to use this, but if you have to do it, you want to know that up front. It's such a simple procedure, and you can save a life with it. You never know when you may be driving down the road or at a mall, at a shopping event, at a bowling alley, wherever many people may gather, and you see someone collapse, and that person can't ask for help. They need help. And it's up to those of us that are in our community to help them. And we rely on each other in that way, and this makes us a safer, more well-prepared community. And I encourage everybody to take the class.
Yeah. What other medical skills are taught in school, like maybe the Heimlich?
The Heimlich maneuver is, or it's more commonly, whatever you want to call it. Dr. Heimlich was the person who invented that maneuver, but it's really first aid for choking. And we've all seen and experienced events where you're drinking a beverage, you're eating and talking, and you swallow something and you start to cough. You start to have that feeling that you're choking on something. And an important skill to have when that occurs, an important piece of knowledge to have is that as long as someone's coughing, they're moving air. They're doing, as uncomfortable as it is, don't hit them on the back, don't do things, allow them to try and cough that up. And often that cough is caused by a spasm of the upper part of the airway, trying to clear itself. But if that piece of food is lodged into their airway, they can't breathe. It often mimics a heart attack. The person gets no oxygen, and you have to be able to somehow remove that. That maneuver, in which you're pushing up quickly on the diaphragm, often called the Heimlich maneuver, can dislodge that piece of food and actually allow that person to resume breathing. Extremely important that that happens quickly, otherwise they will go on into a cardiac arrest. And that's part of the CPR training as well.
Oh. How can more teens get involved in the emergency preparedness effort?
Oh, another great question. Emergency preparedness is something that's very important, obviously, and to me, it seems that way. I can't emphasize enough how important it is. And emergency preparedness is getting ready, not just learning CPR or learning the first aid for choking, that kind of thing, but really getting prepared for all those emergencies and acute events that life can throw at you. I think teens can get involved. One, getting awareness that they need to be involved. Shows like this, and you're talking to your peers, are great ways to do that. We have, in the city of Farmington Hills and Farmington, we have what's called the Emergency Preparedness Commission. We have a lot of information. We have skills classes that we offer that I would encourage all of our teens to participate in those. And then there are other places, other classes and other venues in which people can learn how to take care of themselves.
Do you have anything else to add?
This is something that I'm very passionate about, and I think that one of the biggest things that a community has to do is look out for each other. And the best way we can do that is to learn those key skills that help us. Plus, in the event of an emergency, it helps you keep calm, because panic is terrible, but it helps you keep calm because you know what to do. And just by asking a few questions, some of the topics we've touched on here today and those things that you would learn in emergency preparedness types of workshops will help you have the knowledge that you can take care of yourself and your family and your community for those critical hours in which you're waiting for help to arrive, or those critical minutes in the event of a cardiac arrest.
Thank you, Dr. Massey, for coming, and thank you, viewers, for watching the NYC Talk Show.